Despite the Ghana mental health policy, persons with mental health conditions continue to receive less attention to aid their effective recovery. Aside from the lack of family support, mental health care centers in the Tano South Municipal in the Hafo region lack the backing to help the over 1,300 persons with mental health conditions. Jonathan Aye is the municipal mental health coordinator.
There are challenges with funding and also drugs, psychotropic medications. Our patients are on special medications which they are supposed to take on a daily basis. So sometimes when they come to the facility and don't have these drugs available, is a problem. And aside that, means of transportation. We have to sometimes fund ourselves in order to go to the outreach point.
The situation of persons with mental health conditions was worse during the COVID-19 pandemic, as they lacked medications and were socially excluded. Because of this, MindFreedom Ghana and the National Democratic Initiative of the United States have inaugurated a pilot community support network project for a year at Bechem with other stakeholders. Dan Taylor is the executive director of MindFreedom Ghana.
The main objective is that these are organizations or groups that we're establishing to be able to, for persons with mental health conditions, to assess support in terms of medication, in terms of other services within their jurisdiction. Many a time, people with mental health conditions are not considered as part of society in terms of what should be given to them. So the issue of social exclusion and discrimination is what is the major factor we are looking at. So that once the group is there, they are able to advocate, they are able to reach out for whatever is due them. That is what we are looking at.
I think it's a nice initiative which we are all looking forward to it being a success because there is ignorance within the community a lot. Most of the people see mental illness as something which is somehow spiritual. With the support network, we'll be able to incorporate all these advocates and other agencies, relatives. Without the support from relatives and also people of influence within the community, it will be very hard for the clients to do what to recover. Okay. Medication alone can't do it.
Mr. Taylor, however, wants the district assemblies to honor their obligations to help care for mental health patients.
The Mental Health Law 2012, Act 846, has a section that enjoins all the MMDs to make budgetary allocations on a yearly basis, so that persons with mental health conditions, those are the worst cases that you see on the streets, they are taken for treatment. The mental health authority would liaise with the police and the social welfare, and they will take these persons for treatment at the hospitals, and then they are rehabilitated. They are taken back to their communities, but the MMDs are not doing this.
Precious Semevo, Joy News, Bechem.